Welcome to this in-service presentation, working with students with autism spectrum disorders. Autism spectrum disorder, or ASD, is a developmental disorder that affects communication and behavior. Although autism can be diagnosed at any age, it is said to be a developmental disorder because symptoms generally appear in the first 2 years of life. Given the significant changes in diagnostic criteria and approach over the lifespan of the Diagnostics and Statistical Manual, commonly referred to as the DSM, it is helpful for teachers and counselors to review the current criteria outlined in the DSM-5. According to the manual, people with ASD have persistent deficits in social communication and social interaction across multiple contexts. Severity is then based on social communication impairments and restricted repetitive patterns of behavior with symptoms that must be present early in a child's development, cause clinically significant impairment, and not be ascribable to other intellectual disabilities. Autism is known as a spectrum disorder because there is a wide variation in the type and severity of symptoms people experience. ASD occurs in all ethnic, racial, and economic groups. Although ASD can be a lifelong disorder, treatments and services can improve a person's symptoms and ability to function. According to the CDC, data from 2014 suggested that about 1 in 59 children has been identified with autism spectrum disorder, according to estimates from the organization's Autism and Developmental Disabilities Monitoring Network. ASD is reported to occur in all racial, ethnic, and socioeconomic groups. ASD is about 4 times more common among boys than girls. Studies in Asia, Europe, and North America have identified individuals with ASD with an average prevalence of between 1 and 2%. However, according to a 2018 analysis of data from the U.S. National Institutes of Health, an estimated 2.41% of children in the United States have autism spectrum disorder. The National Institute of Mental Health suggests some examples of the types of behaviors that are seen in people diagnosed with ASD. Not all people with ASD will show all behaviors, but most will show several. Some social communication and interaction behaviors may include making little or inconsistent eye contact, tending not to look at or listen to people, failing to or being slow to respond to someone calling their name or to other verbal attempts to gain attention, having difficulties with the back and forth of conversation, or often talking at length about a favorite subject without noticing that others are not interested or without giving others a chance to respond. Some restrictive, repetitive behaviors may include repeating certain behaviors or having unusual behaviors. For example, repeating words or phrases, a behavior called echolalia, having a lasting, intense interest in certain topics such as numbers, details, or facts. Although people with ASD experience many challenges, they may also have many strengths, including being able to learn things in detail and remember information for long periods of time, being strong visual and auditory learners, excelling in math, science, music, or art. A collaborative planning approach to support students with ASD is most effective and promotes the best outcomes for students. Keeping this in mind, it is important for school staff to invite input from and the participation of parents and, with parental consent, other professionals who have previously worked with and those who are currently working with the student. Through working collaboratively with other individuals, staff are able to better understand a student's learning profile and become aware of interventions that have successfully supported other students or the student in other environments. With this knowledge, staff can plan appropriate program goals and interventions for the student. Universal designs for learning are recommended for consideration by teachers to guide the planning of the various components of their teaching, such as defining the expectations of learning situations and determining the teaching strategies and assessment methods that will be required. Programs designed according to the core concepts of UDL are based on considerations of universality and equity, flexibility and inclusion, an appropriately designed space, simplicity, and safety. In some cases, creating universally accessible classrooms may mean the use of technology. Assistive technology includes highly technical, computerized devices such as speech-generating software, as well as less technical resources such as visual supports. Technology can be used by students to provide alternative methods to access information, demonstrate and reinforce learning, and interact with others. It can also be used by adults as a tool to support the teaching and learning process. Looking more closely at the operations of each day, there are further characteristics of students with ASD to consider. Students with ASD often experience difficulty with change. Establishing consistent practices is promoted through collaborative planning and may help to alleviate some of the challenges for students during transitions, such as entry to school or between grades. Students with ASD vary in their sensitivity and tolerance to sensory stimulation in the environment. It is important to be aware of the sensory preferences or sensitivities of a student and to determine possible elements in the environment that might have an impact on a student's learning and level of anxiety. In some cases, environmental accommodations can be made quite easily. In others, students can be taught socially appropriate ways to access sensory materials and experiences. Proactive strategies to manage sensory issues include providing predictable, scheduled breaks for sensory input, providing a variety of sensory materials and/or equipment that will mitigate a student's particular sensory needs, using engagement in sensory activities as reinforcement for task completion and other classroom requirements or expectations, and performing environmental scans across all environments in a school that the student may access in order to determine possible sensory irritants and make adjustments and accommodations as appropriate. Many students with ASD also have difficulty processing information and may be unable to respond immediately and on demand to expected tasks. They often require flexibility regarding the timing and method used to demonstrate their knowledge and skills. Finally, the ability of students with ASD to participate in or respond to a learning experience may be affected by limitations in communication and social skills. Consideration of the likes, dislikes, strengths, needs, and interests of a student with ASD can help to make materials and tasks more engaging and provide motivation for the student to participate in and complete the desired task or activity. Concrete examples and hands-on activities provide students with opportunities to learn by seeing and doing and have been found to increase the motivation and engagement levels of students with ASD. Thinking about the 4 core domains of academic achievement, there are specific considerations for staff members working with students with ASD. Reading comprehension difficulties are common for students with ASD. Although some students develop an extensive reading vocabulary through whole word sight recognition or through a strong ability to phonetically decode previously unseen words, they may not be able to comprehend what they are able to read. Students' motivation to read and comprehension levels are likely to be increased when the vocabulary and storylines are familiar and meaningful. Initially, when students first engage in reading, stories created about family life, pets, favorite television characters, and similar topics will be far more relevant than stories about things, people, and places that are unfamiliar. While some students with ASD are proficient in printing and handwriting, many others have difficulty with written tasks because of difficulties with fine motor skills. Difficulties with handwriting have been identified as one of the most significant barriers to academic participation for students with ASD in schools today. There are many ways in which technology can be used to enhance and compensate for the limitations that students have in their writing skills. If fine motor skills are a barrier to participation and academic function, educators should seek an alternative or assistive technology. For many students with ASD, participation in mathematics can be a challenging aspect of the academic curriculum. There are several reasons for this. Although many mathematical concepts can be demonstrated through visual examples, they are often accompanied by sophisticated verbal instruction. The language of mathematics instruction has its own vocabulary, and the precision of instruction and usage of terms can vary from one instructor to another. Mathematical terminology can be very complex and is challenging for students who struggle with processing the language of everyday interactions. Many students with ASD have challenges completing homework assignments, particularly as they enter the higher grades where expectations are more sophisticated and complex. Many students cannot generalize between environments. What the students are able to do at school in a particular situation, they may not be able to do in the home environment. Even with written reminders about task expectations, students may forget or be confused about what they are to do. Additionally, by the end of the school day, many students are exhausted from the energy that they have had to expend to maintain their attention, regulate their behavior, and participate in tasks. They may not have sufficient energy or attention to be able to continue task management through the evening. While it can be helpful for students to have some homework, this is an issue that must be carefully discussed by the teacher and the family. In collaboration with other psychological support staff, an additional set of interventions exist to support students with ASD. The following interventions are offered as collaborative vocabulary for staff working to support students with ASD. One of the most important activities undertaken by school staff working with families and children with a disorder on the autism spectrum is to educate others regarding symptomatology. Parents and siblings who have a thorough understanding of the child's issues and struggles, as well as strengths and preferences, have the opportunity to be more patient and helpfully involved in the child's life. School classmates of children on the autism spectrum who understand the disorder and know what symptoms mean can better accommodate the upheavals and oddities that may occur in a class or on the playground. Creating social skill training based on a list of logical, sequential, if-then, social and communication rules can assist those with less severe dysfunction. Teaching to the individual's preferred learning style and cognitive strengths can assist in more efficacious learning. Teachers should not assume that a child can generalize one rule for a particular situation onto another. Each issue will need its own set of rules in simple step-by-step fashion. One-on-one counseling between a child with a higher functioning ASD and a counselor can be beneficial, especially for more explosive or anxious children who can use assistance in emotionally regulating, reducing obsessive interests, activity, and lessening excessive dependence on repetitive routines. Finally, advanced training in applied behavioral analysis can assist a counselor in effectively working with children with ASD. The list of possibly helpful behavioral interventions is long and best used with an understanding of appropriate matching of struggles to intervention. Here is just a small sample of the many available materials and intervention supports available for school staff working with students with ASDs. Thank you for viewing this in-service presentation.